like to call to order the CMH special CMH full board meeting for March 29th, 2023, 2020. Yeah, three. Please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That's what I get for reading. Lori, would you read the mission statement, please?
Sure. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next is adoption of the agenda. I'll take a motion to adopt. Motion from Dana, support from Antoinette. Any questions, comments on the agenda? Hearing none. All in favor signify by saying aye.
Aye.
Aye. All opposed? Agenda is adopted. Next is item 4, hearing of the public. Anybody from the public wishing to speak? You have 3 minutes. No? No? The only public are shaking their heads, minus Dana's kids. They're looking out the window. We'll move on from hearing of the public. I'll take a motion to approve the minutes of the regular meeting of the CMH Full Board held on Wednesday, February 22nd, 2023.
Support.
Motion from Antoinette, support from Lori. Questions, comments on the minutes? Seeing and hearing none, all in favor, say aye.
Aye.
Aye. All opposed? Minutes are approved. Next, I will take a motion to approve the minutes of the CMH program and budget meeting held on Wednesday, March 8th, 2023. Motion from Megan, support from Antoinette. Questions, comments on the minutes? Hearing none. All in favor signify by saying aye.
Aye.
Aye. All opposed? Minutes are adopted. Next, we'll move on to item 7. 7A through I were already discussed at program and budget, so I will take a motion to approve those items.
So moved. Support.
Motion from Dana, support from Lori. Any further questions or comments on these items? All right. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is a new item, item J. Take a motion to approve MCCMH Capacity Building Grants 2023 for multiple providers.
Support.
Motion by Antoinette, support from Lori. Dave, go ahead.
Well, good evening, everyone. If you recall, you gave us permission to issue capacity building grants. We left it very open. Anything that would help our providers provide more services to more people, different locations, different types of services, things like that. We got a good number of submissions, and we did review them internally through a program perspective. Is it something that we think would truly be value added into our system of care? And then we reviewed it through our finance committee to make sure that we did have sufficient funds and the type of funds that would be available to support each of these programs. So the ones who we approved through both of those steps are what's in front of you in tonight's board packet. The first being for community living services. We've contracted with them to become independent supports brokers. It's a model that we've not used in Macomb before, but it's an approved model of service, and it's used throughout the state of Michigan. The intent here is that it would allow individuals to self-direct the supports coordination or case management services that are in their individual plan. In this case, CLS will act as the agency with choice fiscal intermediary. So staff within CLS will oversee the quality and the training and of all of the independent supports brokers organized under them. But the individuals receiving the services will actually then have more control and be the be able to hire and fire those independent supports brokers. They'll be able to interview them up front, choose who they think will work best with them. So since it's a new model here in Macomb, CLS has started on a small scale to start to spread the word, but we definitely want them to help them get the word out more. If you recall, there's also a movement at the state and federal level for conflict-free case management, and we're tracking that process closely. And I'll do a summary at a future board meeting and stuff. But this will give us another option for individuals. We'd like to target the folks who are currently self-directing their services, and then kind of keep spreading it out from there. So what they're proposing is, just an expansion of that. So that was up to $100,000, and we'll draft out the exact details and move forward if this is approved. The next one is STEP, or Services to Enhance Potential. Again, they presented at the meeting last week. They're a newer provider here in Macomb County, so to help them get the word out, we're looking to fund the outreach coordinator and some outreach materials to help them spread that word. And you did also support, as I mentioned last week, the Project Search program and the peer program, which STEP is involved with both of those. That's the total of $58,000 up to that amount. MyCare, you're probably all familiar with. They're our FQHC partner. This was a little bit different, but we did approve it through finance, that we do have a fund source available in this area. So it's for their Centerline program to do some additional build-outs to support the behavioral health there. And that's up to the $49,621. Creative empowerment opportunities. You all know Sean, though I haven't seen him at the last few meetings. They submitted a request. Basically, the part of their request that we supported was to allow them to purchase some memberships to a lot of the local activities. We very much encourage our folks to be a part of their communities and to be as involved as possible. It's kind of a fuzzy area in the Medicaid rules, how skill building providers and staffing providers can cover those types of activities when they're out in the communities. So to support that, we're offering up to the $57,513 for those memberships. Cygenics is another new provider to us. They wanted some money to do a build out for their speech and occupational therapy. What we did there was, this was the biggest area that we received capacity building grants in, was with our PTOT and speech providers to build out their physical space. There's a lot of equipment needs and things when you're providing those types of services in a clinic setting. So we just standardized the amount across the board. So all of those requests, they requested more than that, but we just kind of capped it across the board so it was equal to all of our PTOT and speech providers. The other part was the outreach program. This is very much needed for us. We're looking closely at access to services, and the outreach team will serve two purposes. At the front door, for people who don't keep their scheduled intake appointment, right now there is no consistent follow-up. We'll now be able to track those individuals and provide a list to Cygenics on a regular basis. They'll go out and we'll set up a payment system, so when they actually are able to locate the individual, have a face-to-face, see if they're still interested in services. The focus is on getting the people re-engaged if they want it. and then making sure that they're aware of their choices and options. So it could be that somebody was coming to me for services and they didn't care for me, so they just stopped coming. Cygenics will go out, see if they're still interested. They're like, yeah, I still need help, but I really didn't care for Dave. And they say, well, you have your choice of Tracy and Mark and, Donna and Lori. And they're like, oh, well, Lori's right near me. So it's that type of reconnection, helping them, is it transportation barriers, what was going on. It's another level of outreach and intervention to help, like I said, keep people engaged as much as possible. So to get that program started, we were offering up to the 300. Then another PTOT and speech provider, they requested specific to two of their sites, the 10,005 and the 3,200, and crawl, walk, jump, run. Broke it down by low, medium, or high. We picked the medium for up to 10,000 for that one. Now they're going to listen to this board meeting and go, I could have asked for 94. So along with those, you have the supporting documentation from what they provided. We do have some, like I said, some additional applicants. We are reaching out to some to ask clarifying questions. So this might be our first round, but I think we're off to a good start, and we'll continue to update the board.
Thanks, Dave. Questions, comments? No? Lori, go ahead.
I had attended the explain the CLS with Dana. I've seen him around. He's been around for years. But anyway,
It was Annette Downey, and
their entire presentation.
CLS had an unfortunate death that they informed us of, and it was Jim Kelly, he was the Macomb County lead.
Yes.
Jim he's been around for years. I worked with him in Wayne County. He was mayor of East Point at one point, but he passed. Been a while now, but they did inform us and stuff. So
Opportunity for all of us. I mean, there, little different concept than what we're used to, but I think it's going to be
yeah, I've seen presentations at conferences. It changes the dynamic up in a really good way. So I personally support the program. I've been talking to Annette for a number of years since I started here. Like I said, they offer it statewide in a number of different counties. So we switched it up a little bit by making them the agency with choice fiscal, but they were open to working with us under that model. So.
Thanks, Lori. Any other questions, comments on this item? Seeing none, all in favor say aye. Aye. All opposed? Motion passes. Thanks, Dave. Next is item 8, receive and file. Take a motion to receive and file CCBH 2023, contract number E20234596.
So moved.
support.
Motion from Donna, support from Lori. No comments, no questions. All in favor, signify by saying aye.
Aye.
Aye. All opposed? That is approved. Received and filed. Sorry. Next is item 9, a resolution. I'll take a motion to adopt the resolution for Laura KC8. Motion from Megan, support from Antoinette. Any comments from the board? All in favor say aye.
Aye.
Aye. All opposed? Resolution is adopted. Next is item 10. Take a motion to pay the bills.
Support. No, motion to pay the bills. Support.
Motion from Lori, support from Megan. Comments, questions on the bills? Seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Bills are paid. And now we'll go back to Dave for a management report. report.
There we go. Well, since last week, thanks to Phil for connecting me to Jamie Cook from the Macomb Daily. I saw the email feedback and stuff on the article. Appreciate that. We are working very hard, like I said, to improve and increase the access to services to make it easier. So again, thank you. You approved the media marketing. We'll be working with that agency closely to help spread the word and change up the messaging. I've also been aware of the ARC Macomb is producing some commercials, some video clips about the benefits of being a direct support professional. I was able to view them, and very powerful, really good messages. Somebody who wants to become an occupational therapist, other people who just, right out of high school went into that field. Somebody wanted to be a social worker. I tell everybody I started as a direct support professional, working my way through undergrad in psychology, and it was a great experience, and it's been my career. So lots of really good things happening out there. We were able to tour the Juvenile Justice Center on Monday. We had 3 people come down from the Michigan Department of Health and Human Services. We had discussions. Selena and I caught Krista Hauserman at the last conference. The idea of running some new and creative programming out of a juvenile justice center, they were real hesitant. But I think that the visit went really well, and they kind of saw our vision about how things could be softened, modified, and utilized in really creative, interesting ways to help our community. They were supposed to have a meeting today. I wrote to Krista this morning about some of the other uses for that building. There was a concern that there would be too much empty space because it's a 144,000 square foot building. But we could really make it active and lively and part of our community's infrastructure. So stay tuned for that. There was a possible next step, which would be, TJ did a great job of sketching out some of the ideas for the room. But if the state gives us a positive nod, then I will come to the board and ask that we be able to put out a RFP for an architectural firm to actually work with us and go much deeper on that. There is also $100,000 available to us from because we became part of the state's crisis stabilization unit pilot. At first, I said no, we really didn't need it for because there was no use. But in this case, we could use it to help cover the cost of the architectural designs as we move forward in here. Vicki Wolber was there representing the Office of the County Executive, and we're very much all on the same page that this would be good for Macomb County and offering some real creative program ideas. I was also able finally to connect in person with Kevin Fisher from Michigan's NAMI, or the really good. It was nice to finally chat about Macomb County. So now there'll be some follow-up in that area as well. Really hope to, kind of give a shot in the arm to those types of advocacy services here in Macomb County. We have a great relationship with the ARC Macomb, but NAMI hadn't been as well connected. And then I wanted to update you that the quarterly leadership meeting was all day Monday. I ran out to go over on the tour with the state. But in our quarterly meetings, we wrap up our 90-day projects and set some new ones. So we'll get a summary update out to the board about where we are in that process as well. And then finally, Tracy, I'll kick it over to you for an update about our May event. Because Tracy every day is doing more and more on that topic.
So where we're at right now is the next step is I will be sending you communications asking how you can help. And there's two main areas how you can, well, three. One, I'll have a communication about, hey, here's a printable form so you can share to the community how to nominate. Here's a social media post if you'd like to share. And just getting the word out there to nominations, because we do have a few more, but we need a ton more because we want to make this event successful. The other way that you can help is I will have volunteering opportunities. So I'm going to give you an example. If you want to be a part of the registration team, I have the job description about what that registration team looks like. So I'll send you that. And if you go, that's how I want to help, then you would send me that information and I would, follow up with you. Then the third opportunity we're trying to get assistance with is prizes. So I have some descriptions of ideas, but the concept would be I'll share a document where maybe you could show it to anyone, whether it's the organization you work for or your neighbor or whoever it is. And it gives ideas about, hey, we're really looking for somebody to donate iPads, crock pots, laptops, those typical things, TVs. But then it also gives you like some basket ideas. I'm sure you guys have all been to events where people can win prizes, right? So as an example, I have the idea of a barbecue basket, a picnic theme or whatever. It doesn't mean that's exactly what we're looking for. We're just trying to give ideas because you guys know when you ask for something, it's really important to be detailed in what you're asking. And in that information, we'll put in like, if you'd like a tax deduction, this is how you go about getting credit for that particular tax deduction. So that is the next communication that you should be receiving in the next couple of days and kind of where we're at right now. Now, there is a setup crew, but it's traditionally, it's the day before and the day of, but there are other things that you could help with. I mean, even if getting somebody to do a basket, or there's lots of things.
Shameless plug, I'm gonna tell my boss, because it's recorded, I got the Hallmark connection. So I'll look in the basket.
A Hallmark
And tell
basket.
them to watch the video, so it's just the pressure on.
Yes, and I'll give you the documents that way you can have something, what it would look like.
And finally, tomorrow afternoon, from like 11 to 1, I was contacted by Brent Worth at Easter Seals Morgue, and they're having an event tomorrow, a media event. Farrah Hanley will be down from Lansing, and they're having a special partnership now with Oakland University about creating that pipeline for people coming into community mental health at all the various levels and stuff. And that's something we've talked about. I've been in a lot of meetings about our staffing crisis. And one of the things is we need to increase the public awareness of that we're here and the benefits of working in community mental health. And starting really in middle school, that this could be a career path. So Easter Seals is building on that, and they have a really nice partnership with Oakland University that I will learn more about tomorrow. Thank you.
Thanks, Dave. Thanks, Tracy. Any board members, any questions or comments for Dave or Tracy? Okay. We'll move on to other possible agenda items. All of these reminders are from last week. Nothing's changed. CMH program and budget meeting will be Wednesday, April 12th here at 6. We have a recipient rights committee meeting Thursday, April 20th at the CMH administration building. And full board will be here Wednesday, April 26th at 6 p.m. Any board members have anything for the good of the group? Thank you all for being here today so we can have this meeting. I appreciate it. With that, we'll move on to hearing of the public. Anybody from the public? Okay, seeing none, take a motion to adjourn. All in favor? Aye. We are adjourned. Thank you, everyone.